Everybody, welcome back, and today we are going to conclude this last video, and this one is on PMS. As you can see here, we're going to go over the many symptoms of PMS. What could it be all throughout the body? What are the root causes that some experts have discovered that has helped their clients? What are some dietary considerations as well as helpful supplements? So without further ado, let's get started. And as always, this is educational purposes only. This is not to override your doctor's clinical judgment as it relates to your customized needs. So let's talk about premenstrual syndrome, PMS. This is the most popular topic we've heard. There's commercials over it. And what we see it here is a monthly recurrent of physical and psychological symptoms, very similar to PMDD. But it typically starts 2 weeks before your monthly period, so ovulation and day 1 of your period. And then typically it's preferred to keep a diary of your symptoms just to kind of go over what's causing it, how you're feeling, energy level, mood, physical symptoms. And with this, you can also do a 28-day saliva test to really check your symptoms. I would assume that's pretty costly if you're looking at a 28-day saliva test just to see if there's any hormonal irregularities. Most people would stick with the progesterone since it's day ovulation, day 14 to day 28. They'll try to stick to that 1923 when they do a lab test because most of the times it is progesterone or an elevation of estrogen, also known as estrogen dominance. So but I'll get off that soapbox. Let's talk about some of the symptoms. Now, first, it can be physical and somatic symptoms. So think about aches and pains. You can also have fluid and weight issues, skin and mucosa. So when you're looking at acne, flare-ups, hives, rashes, bleeding gums, herpes outbreaks, maybe you have something dormant and that time of the month really gets you stressed. And then your vital signs, you can have blood pressure increases and also palpitations. So be very wary of those symptoms. They can be along with your PMS. The other symptoms are neurosensory or coordination symptoms. So think of sensitivity to light, hearing, ringing in the ears, hands and feet, feeling those are real tingly or tremors. A lot of individuals also have vision issues, whether it's eye pain, conjunctivitis, or just visual changes or just poor vision in general. And then motor skills, right? Feeling clumsy or having poor coordination. Now, some cognitive and mental health symptoms, confusion, difficulty, emotional things like mood swings, anxiety, restlessness, or one of the worst, fear of losing control. And then, of course, behavioral, right? You got the avoidance of just certain social activities, fear of going out alone, and things like that. Now, when you look at GI or metabolic, when you're looking at digestion, I mean, your gut is just twisted, right? So nausea, vomiting, diarrhea, constipation, and bloating. When you're looking at sensitivities like your appetite, you might be craving the salty or the sweet foods. And then you might even have alcohol sensitivity, like one drink just does it for you and you just can't handle anymore. But with that, we typically notice sleep and energy symptoms. So insomnia, drowsiness, fatigue, just not getting good enough sleep and feeling exhausted the next day. And then decreased sex drive, right? Within that day of ovulation where you should have the most, arousal that you don't have that. You have a decreased sex drive. So when you look at other symptoms, there's also respiratory. Anybody with asthma might have more asthma attacks, feel runny nose, sinusitis, get sick and clogged up, bladder irritations, and of course, one of the most common ones, headaches. So this next slide, we're going to talk about the root causes of PMS on how experts have kind of found that helps their clients. So we'll start off with the hormonal imbalance, right? So typically you get the drop in estrogen and progesterone between days 12 and 14. And with that late luteal phase, This triggers physical and mood shifts. So when everything is kind of falling down and then crossing over, that drop in estrogen can really cause those types of mood changes. So after day 14, you typically will be feeling something like that. The other thing is neurotransmitters, right? So think about the fluctuating hormones that causes the decline in serotonin. So when estrogen drops, serotonin also gets imbalanced and dopamine. And with this, it could potentially increase norepinephrine, which is a little bit more excitatory. And so therefore, you can have some issues with that type of neurotransmitter differentiation, as you will. Now, the other things are nutritional and mineral gaps, right? Now, medical history, really looking for oral contraceptives or progestins, you can really see long-term effects as associates with those. The last thing are the dietary triggers. This is what I said in PMDD, but there's caffeine, alcohol, high salt intake. Remember, high salt really bloats you up. And then, of course, blood sugar instability. So, constantly eating processed foods, high sugared foods, foods that are constantly putting insulin in your body can really cause a lot of issues later on down the road. Now, let's talk a little bit about the dietary factors that have been associated to worsen PMS. And the way they figure this out is that they've taken a survey with people with really bad PMS symptoms and they kind of ask them different dietary questions. And this is what they noticed out of the people that did have really bad PMS symptoms. So, not only are PMS sufferers consuming 275% more refined sugar, but they are also getting 50 to 70% fewer critical minerals like zinc and manganese. Okay, now this creates that metabolic environment where the body cannot properly manufacture or clear hormones. Now, kind of understanding the cravings. Now, if you're reaching for sugar, your brain is likely searching for serotonin. Now, while eating carbs helps the brain take up tryptophan, that's the precursor for serotonin, the sugar high, it's short-lived. It ultimately just flushes the magnesium out of your system, which we know is kind of like the relaxing mineral that you need to sleep. Now, when it comes to fluid retention, high sodium, high sugar, those both cause your body to hold on to water. So this is why women feel heavy and experience sometimes breast tenderness. It's a cellular hydration imbalance triggered by the diet. Now, when we identify the culprit, right, I always recommend single variable eliminations. What does that mean? So if you cut out dairy, caffeine, and sugar all at once, you won't know which one was causing your symptoms. So start with one for a full cycle and then move to the next and see how you feel. Keep that diary and keep those notes identifying how you're doing. Now, here's the protein pivot, right? We want to replace simple sugars with high quality protein, which can help not only stabilize the blood sugar, but it prevents the angry outbursts and those 3 p.m. energy crashes that are very typical in those luteal phases. This also will help you, when your sugar crash, you're not reaching for sugar more, right? So these are some things that I kind of want you to think about. How do I lessen the symptoms, the intensity? And let's go over, some supplements that we've seen in PMS now. So when we look at certain supplements, I always mention magnesium. I mean, it works over 300 enzymatic reactions in the body. There's also pyridoxine, or you want to get the active form of vitamin B6 because B6 is going to help push magnesium into your cells for better relaxation, better comfort, and as well as other things, right? I think there's over like 100 enzymatic reactions that vitamin B6 can take. Vitamin E is known as an anti-inflammatory. Tryptophan converts to serotonin, which then converts into melatonin. So very important there. Calcium is good for your muscles and your nervous system. Manganese is one of those underappreciated. Zinc works throughout your hormones. Evening primrose helps with your hormones and some anti-inflammation. And we all know omega-3 fatty acids, not acids, like I spelled there. But anyways, when it comes down to it, a nutrient-dense diet, filled with a good professional grade multivitamin can cover you, with the addition of magnesium, and then just eating a good Mediterranean diet with omega-3s and tryptophan. So getting those bird meats like turkey or any type of chicken can really help lessen. And remember, you want to be eating at least 3 good meals and 2 snacks in between throughout the day. And I always teach something called time restrictive eating, which is typically 12-hour eating window and cutting it off every single day at the same time. Now, when I look at magnesium, like I said here, some symptoms of low magnesium, you could notice anxiety and depression, irritability, headaches. The dose is typically 400 to 600 milligrams. I will divide that by 2 throughout the day. So take something at lunch, take it in the evening. Magnesium is really great in the evening, and always combining with B6. Here's why. So B6 is a cofactor for over 100 things in the body, right? So it helps to convert L-DOPA into dopamine, which can prevent brain fog. Now in the kidneys, low dopamine can lead to that sodium retention, which causes the bloating. Now B6 helps to convert 5-HTP to serotonin. So tryptophan, 5-HTP goes into serotonin, which is our happy neurotransmitter. Now, if we're deficient, then we are prone to depression, carbohydrate cravings, and insomnia. Now, B6 also helps to create cysteine, 2, taurine. And no taurine, then your nervous system is stuck in that excitatory state. So taurine can help with more calming sensations. And then lastly, B6 helps with histamine production. So a lack of histamine can cause inflammation. This can also make you more sensitive to foods right before your period. So when you look at B6, it has its hand in so many things into the body, especially pushes magnesium in the cell, as I've highlighted twice. Super important for me, right? Skeletal muscle, smooth muscle, you want it all over. So in PMS, this really helps. What's the dose? Right there in the middle, 100 milligrams. And the pyridoxal 5-phosphate, P5P, that is the active form. So if you're going to get a supplement at GNC or anything like that, that's the one you really want to search for. 50 milligrams is fine. So if you want to take 50 milligrams 2 times a day, that's fine. Or if you just want to take a B complex, a professional grade B complex, you can do that. Now, some other considerations, we mentioned vitamin E3, right? 300 IUs daily. This can also help with fibrocystic breast disease. It's not a game changer in any means, but it could help. Tryptophan, right? Making sure you're getting adequate amounts of tryptophan in your diet. So 500 milligrams to 2 grams. Typically with protein, you want to eat it throughout your day so your body has the ability to absorb it. Calcium, you have to make sure you split this one up. Anything more than 500 to 600 milligrams, your body poops it out. So make sure you're spreading calcium throughout the day. And then of course, zinc, you can typically get it in your multivitamin, but if you need something higher because you're zinc deficient, 10 to 15 milligrams with 1 milligram of copper, so you don't have that imbalance. That's important. So just kind of look at those as other consideration. This supplement right here is called Alpha Base. That is the multivitamin I recommend to my clients, my family, my friends, myself. I take this one as well. Now let's look at some other ones. Now, we've seen evening primrose anywhere from 3 to 6 grams per day as a really big thing, and this is why. It has a gamma linoloic acid that bypasses those abnormalities of that prostaglandin metabolism, right? So you can really get a lot of improvement, not just with that, but the fibrocystic breast issues. It can be a little pricey. So a lot of my clients end up doing the omega-3 fatty acids. I like this company, Orthomolecular Products. They do everything like you would want them to do. Everything is sourced appropriately, it's manufactured appropriately, it's tested. Their facilities are amazing, and they have so much knowledge when it comes to formulation as well as just functional medicine and so many other things. So I like to use omega-3s. If I use them, I'm typically using that one. The only issue, you have to have a provider to recommend those. Now, we hear a lot about black cohosh. It does have balancing effects on estrogen, right? It also works as a relaxant, a sedative, antispasmodic, and the dose for standardized extracts are anywhere from 20 to 40 milligrams twice per day. Typically, you would start that around ovulation, so you can really help, get rid of some of that estrogen, as well as, just kind of helping to get more relaxation, since that's the time where you're always having those symptoms. But just remember, anybody with liver issues or have medications with that can cause liver issues, you want to be very cautious. So talk to your doctor or your pharmacist, ideally your functional medicine doctors, so they can really break that open. Now, this one's a popular one, chasteberry, because a lot of women that I talked to that were on birth control, high stress jobs, they have just given birth, and they've noticed their progesterone is lower than normal, or they have something called estrogen dominance. This is a popular one because this acts like a diuretic. It also binds to opioid receptors, and it also helps to decrease um, prolactin, which is something that I noticed that when you can reduce prolactin, especially after children, it does raise your progesterone. But just remember, if you're breastfeeding, then that's a whole different topic. Don't take this, okay? Make sure to talk to your doctor. But the dose is right there. Chasteberry, 250 to 500 milligrams per day, 20 to 40 milligrams a day if you have the dried fruit extract. And I would break these up and just kind of start with one capsule a day to see how I feel on it, see if there's any side effects I need to be worried about. And then with that, the next monthly cycle, go ahead and move it up to that targeted dose, 40 milligrams a day. So if you're doing 20 twice a day, perfect, right? So with that, what are some prescriptions? Okay. Now, if you remember a couple videos ago, we talked about bioidentical progesterone really is the preferred over synthetic progestin. You'll see progestin a lot of times. If it doesn't say progesterone, it says methoxyprogesterone or all these like random names around progesterone, chances are it's a synthetic form. If you're looking for a doctor to prescribe or to evaluate you, it might be good to start with the pharmacy. Look up compounding pharmacies. Pharmacies that are PCAB, PCAB accredited are probably going to be your best source of information. Other pharmacies that work with a company called PCCA is a great source of information, because then they have a much larger network on how to compound those medications, how to test for them, and they just supply pharmacies with a good amount of education on how to get bioidentical hormones balanced. So those are two great resources, and then you can start asking them who are their doctors that they work with that they would refer their family to, and that would give you a good starting point on which doctors you can go to. Now, most of the time you'd be starting progesterone if it's low or PMS symptoms indicate there's an issue with progesterone. And basically you would use it on day 14 to day 25 of your menstrual cycle. Take a break. A lot of times it's going to be a cream. So you'll apply it to an area that you'll just alternate so you can get maximum absorption. Now, if you do have insomnia, they do recommend taking it as a pill because it does cause sedation. So that's kind of a good thing. Now, most of the time they're going to have you do saliva test when it comes to progesterone, but you have to remember day 19 to 23 is that window that you typically get tested, unless you can do a 28-day saliva test. That's a different thing. But with this, that's pretty much everything that I wanted to show you about the female monthly cycle and how sleep can be affected. So the whole point of this, very much like menopause, is to make you more aware so you understand that it's not all up here. There are things going on inside the body that can cause these issues to be worse, which can cause sleep to be much harder for you. And when you are more aware of things, then you can appreciate them, because a lot of the things going on in these monthly cycle are things that, number one, are controllable, which you can lessen the severity, but also create a sense of appreciation on that this is happening in your body and it is completely normal. So I hope this information has been helpful. So if you have any questions, you have any comments of future videos that we can do, I'd love to hear them. With that, please like, subscribe, and share, and I will see you in the next video.